How do professionals find information online? How can this be helpful to your future career? Here we have advice from professors to help you find reliable information. I-Know defines digital information literacy as the ability to find, evaluate, create and communicate information effectively and responsibly using the appropriate technology. I-Know teaches students digital information literacy skills to help prepare them to navigate the future of digital information.
In these videos, our I-Know professors tell us how they relate the importance of finding and evaluating information to their profession. This is I-Know Insights, faculty discuss information literacy in the professional sphere.
It depends so much on where you're working. The hospital organizations now have invested in resources that the nurses can access right at the bedside, right in the med room, on the computer that they're using for their charting and looking up patient labs and looking at orders. There will also be a drug book, a policy and procedure manual, maybe like patient education materials, A to Z. So if you're working at a place like that, then that becomes really easy, right? Somebody has already looked at all kinds of products and chosen something for this hospital that's going to give the patients and the nurses, the other healthcare providers, great, reliable information. Somebody's even paying for that, right? Now, if you're a nurse who's working out in the community, then you may be, like most of us, using tools like Google to see what can you find real quickly just on your phone to share with a family member, a patient. But so then in that case, the nurse has to use their own judgment to think about going to a really reliable source, like a national organization like the American Cancer Society or the American Academy of Pediatricians. So the nurse still has to evaluate quickly on their own what they want to share with the patient. Another important piece of that we teach our nurses is that it's always okay to say you don't know, but then you'll find out. So if the question that the patient is raising or the family is raising is more complicated and a quick Google search is not gonna suffice, then the nurse can always say, I'll get back to you with that information, and then go and use other resources. Maybe it's a question about a new drug. Maybe we need to call the pharmacy and talk to the expert over there and see what materials they would use. So we always have that route to explain, that's a great question. I want to get you the best information. I'll get back to you. I think it's going to depend on the setting that the nurse is working in. If they're having to find new things every day. Wherever you work, wherever a nurse works, there are going to be, maybe a dozen things that are very common issues. Like we know we're always going to need to have information about wound care in the emergency room to give to people to take home. And we also know we're going to need it in English, we're going to need it in Spanish for the hospitals here, right? So there's going to be some materials that we just have that we've hunted down, and we've found things that are really great that give the instructions that we want. But if something new comes in, like a certain kind of snake bite, well, then maybe we don't always have that information. So we're going to have to track down some good information. I worked as a nurse educator in a NICU up in Central Texas for a couple years, kind of in the middle of my clinical practice. And my whole job was providing education and materials to the parents of the babies that were in the NICU. So yes, I had kind of standard packets. What is the NICU like? What can you expect? Who works there? That I would be giving to parents whose baby just got admitted, or if we anticipated that the baby would be admitted, then we could give that information earlier. But then sometimes new problems would come across, like how do you breastfeed a baby with this one particular problem? So I don't want to tell the mom, well, you just can't breastfeed. I need to, in my role as the nurse, see what I can find to support that mom and what she wants to do, go outside of our one unit to see what is happening out there in the world. So yes, maybe not every day, but we definitely do this regularly. Well, things have really changed, right? Now, here we are in 2024, and it's so easy to find information from all over the world. I started my practice pre-internet, was just kind of on the edge of that. And now we just have such easy tools. And we've shifted in healthcare from a time when nurses were told, don't have your cell phone on you while you're providing care, to everybody's using their phone as a resource to communicate, to teach. So it's just become a lot easier. Now, on the other hand, that can be overwhelming, right? Because there is so much out there. How do you sort out what is going to work? So that's where the education that nurses get in the university is really helpful, because they're going to learn how to kind of use keywords to focus down what they need. Like if they have a patient from a certain cultural background, well, that's going to be an important piece in looking for educational materials for that family, versus just a general question about how should we, what kind of nutrition is important for this? Well, we can add keywords in to help focus our search now. Nursing is a fast-paced job in a fast-paced environment. So back in the olden days, right, we would send the nursing students the day before their clinical to look at the charts, look up the medications that the patient was ordered, and come prepared the next day, all that information ready to go. But now things happen so quickly, those patients may not be there, or if they are there, things may have changed overnight in what medications they're getting. So you can't think, oh, well, I'll just go on yesterday's information. You have to be able to pivot and adjust to what's happening now. So we used to, again, dating myself, we used to say, bring your drug book with you. So everybody would be carrying their little drug book around, and the drug books would come out on an annual basis. But now even that is too slow, right? Again, the recommendations can be changing so quickly, and we've got to be able to keep up with that. So we need to be able to access information that is up to date. And not go by some old information. Yes, there are things that have not changed in healthcare. Women still have babies. We all still need to wash our hands. There are, things that do not change, but other things change very quickly. So much of nursing school and then nursing practice is about practicing things. And so, students will be surprised when the faculty will say, well, have you looked up what American Heart has to say about that? Or have you looked at what's on the CDC or the World Health Organization website about that topic? They're like, oh, how did you know that? Well, we've been practicing for a long time, right? So we have our go-to materials and places that we know we can count on that are going to give us great patient education materials. Our students, they are practicing while they're in school. That's why it's so great that we started this I Know project in their first semester of the nursing program. So then they're kind of reawakening those skills, and as they move through their other courses and their other clinicals, they can fall back on, oh, right, let me look up what one of the national organizations says about this. What does A1 say about this? And so it's really about practicing those skills, then you get faster and better at them. Two of the big problems our students face are time, right? They are struggling to manage their time and get all their work done, and many of them are also working outside of going to school, helping out family, and so they don't have hours to spend digging through results. They want to find something quickly that they can use. So time is a big issue, and then students being overwhelmed by all that's out there, right? If you just search for newborn care, that topic is so huge, you would be quickly overwhelmed by the tsunami of information. So they need to develop ways to narrow down the information and remember that they can help each other and come to their faculty, use their resources like the librarians when they are searching for something to help with that stress of being overwhelmed by how much is out there.